there is a story behind how this came about. I had the holographic breathing and was happily doing it. And this mother brought a young boy, I think he was about 10 or 11, something like that, and he had an underbite. His jaw was protruding and by quite a long way. He'd had a lot of healing, craniosacral therapy, cranial osteopathy, from 4 or 5 years onwards, and it probably helped it, but it still was protruding a long way. And I worked with him cranially, and it was okay, but he wasn't really interested. It was like doing a session on someone that really had enough. He didn't want any more because his mum was just taking him from different people. So I said to him, I'm quite happy to treat, his name is Gwilym, I'm quite happy to treat Gwilym, but I don't really think he wants to do this. And I said, what I would suggest is you go away and have a conversation together, and maybe he'd like to learn holographic breathing, and we'd dress it with the holographic breathing. So they went off and kind of had a discussion, and he got clear in himself that he didn't want any more treatments, but he would like to try the holographic breathing. So he came and learnt the holographic breathing, and the jaw was obviously protruding, but the problem was that the maxilla, this whole central part of the face here, this was pulled back, so the jaw was further forwards. It was like this, and the problem isn't to try and get the jaw back, it's to allow this whole area to basically start moving, to start breathing. So I taught him the holographic breathing over a couple of sessions, with an emphasis of getting that area to breathe, and it's not to try and pull it forwards, but just opening and closing, and in that opening and closing it just naturally starts adjusting, because before that it's held in a position, but it starts breathing, and then it's a parameter rather than a place, and as soon as it's a parameter it can adjust, it can move, and it slowly started adjusting. And I didn't hear anything from them for about a month, and then his mother phoned and she said, well, it's really quite amazing. I said, why is that? She said, well, he's done the holographic breathing, and after a couple of weeks suddenly it just all opened up and moved forwards, and this was, it's about a quarter of an inch. It was a big thing. And his whole nose changed shape, his whole face changed shape, because when you've got the jaw is forwards like that, you get this very flat moon-shaped face, because the maxilla is pulled back in, the nose is pulled back in, and that all opened up. She said he's actually got a Roman type nose now. His nose has really come forwards. And I said, well, that is amazing. That is, quite incredible.
Before and after.
And she said because he was seeing a holistic orthodontist at the time, and she was giving the instructions. She said, well, it needs to come forwards, and she said, well, I've taken him back to Grace, and Grace says, well, that is incredible. We don't need to do orthodontics for that anymore. But what is happening is that the whole of the upper and lower jaw were held medially. It was too narrow. It was pulled back in a narrow way. And I said, okay, well, I can work with that, because I had worked a lot of that with the upper jaw and the movement of the roof of the mouth and the upper jaw, but I hadn't particularly worked with the lower jaw. I'm just trying to remember which way. Yeah, so we started with the upper jaw and the roof of the mouth and getting that working, and he went off to the dentist, and after practicing for 2 weeks, he was young. He's not like an adult where it takes quite a long time, because he's young. Pardon?
How old did you say he was?
He was, I think, 11. And so that did open up laterally, it did open to the sides, but the jaw didn't. The jaw stayed closed medially. And I thought, because I was just expecting that would open and the jaw would follow. So I just started practicing with the jaw, my own jaw, and very quickly, within just a couple of minutes of saying, well, let's see if we can get just with the breath, opening out laterally on the in-breath, closing medially on the out-breath. Let's see what happens. So I was just doing that. And then suddenly, I was doing it or visualizing it to start off with, opening, closing, opening on the in-breath, closing on the out-breath, along with the up-down motion. And then all of a sudden, again, in the same way when we learn the first part, it's like the body remembers it. Oh, yeah, okay, off we go. Suddenly it's like, whoa, this great big movement. Like when you're doing cranial sacral therapy, it may be physically an imperceivable motion, but in your hands it feels big. And this just felt huge. You're just like, wow. So I was being with this opening and closing, and it started moving through my whole body. It moved from the jaw, through the face, through the neck, through the cranium, and slowly. And again, it may be one of these things when the first time it comes through, it just happens very slowly. Then you teach it to some people, then it speeds up, then you teach it to more people, and it becomes an energy and stronger and faster. And I think because, again, it was the first time, it was just slowly. And it was just like working out through the cells, and it just slowly worked down my arms. I could just feel the lateral motion in the cells, and then through the chest and down into the lungs, into ribs, down through the pelvis and through the whole body, till my whole body had this lateral motion. And it was very interesting because there was a female quality to it, and I was getting lots of, it felt like my mother was coming and psychically being with me, which I didn't really want, but I realised it wasn't that. It wasn't my mother's energy coming to me for some reason, because in the quality of the energies in the images, it was from her much younger. So it's me as a young child. And I realised it was the whole quality of my mother and the different things that have happened, just releasing out of me, letting go. So it was embodying the female quality and was clearing different trauma, different upsets along with that. It's a bit like you can have something go on which may close something down, and what you may call a trauma, you may call that a trauma. But for me, one of the things that does is it will often stop a quality coming through, and the upset isn't the trauma, it's the lack of that original quality that was shining through as a gift before. So if that gift, that quality, that energy starts shining through, conversely the trauma just starts evaporating and no longer becomes a concern. So as that archetypal female energy started shining in, it started just removing things in that field. They no longer were traumas, they no longer were upsets, because you're connected to that quality. And when the images of my mother had worked their way through, it started working down through the female lineage, kind of on my mother's side of my grandmother and the different women through that, the female lineage. So clear through that. So the sideways motion, it seems very much, or the lateral motion seems very much to do with the more female energy, and the up down motion, the vertical axis, has a much more male quality. So we've started with the male quality, and now we're going to open up the female quality. And the same as when we were working with checkers, and we were working with the male and female energies and how they come together and how they create the kundalini, the different qualities of it. That happens within you when you get the sideways motion going and the up-down motion. You get a tantric play going on between the male qualities in yourself and the female qualities in yourself. And it was also interesting because I think Andrew came along and did one of these many years ago with this sideways motion. It was also like a pair of gills, because the mouth is one thing, but when you get to the side of the head and the side of the neck and you start feeling it feels like a pair of gills, and it acts in the same way. And then suddenly I would become like a fish, and I'd be lying in bed on my back being a fish. I think, oh, I've got to turn over, only dead fish lie on their back, so I'd actually have to come on my front. And you'd get the whole sideways motion of the spine, and how the water is the breath for the fish, and how the movement of the movement of the spine, not only is it correcting the spine all the time, it's the medium of how the fish moves and how it breathes, because as it's going through the water, it's also water is going through the gills. So you see that whole thing. And then there was another way where that would progress, and I'd become a dolphin. And then there's another way of doing it where I become a whale, and you really see that whole shamanistic side of it, which we will teach with this. So so that all went. And with Willem, when we did the jaw, the lower jaw, a couple of weeks later, that had all opened. The dentist was like, because it's a big solid thing, the jaw, really, and you don't think that in a couple of weeks from being held medially it can just open up. And what he was faced with, I think they were only kind of 6 months away, because he was getting to an age where it had to be done. He was going to need 1/4 of an inch taken out of both sides of his jaw to bring his teeth back in a line. So not only was the maxilla held back, but the jaw was held back, and then it's kind of fixed, and it's a very traumatic operation. So it was kind of like a little miracle for them, really. Suddenly he had a way of doing it himself. He no longer, Grace said, he can come off his orthodontics now. He no longer needs them. He was an oboe player. Suddenly he could play the oboe properly because his mouth was properly aligned. And they both William and his mother, wrote the story, and it's on my website on the facial alignment page. So there was quite a thing to how this particular motion came through. So in holographic breathing, there's a gentle motion of the jaw. Jaw opens on the in-breath, closes on the out-breath, and it's a small motion. And people find their own amount, and it varies over a period of time, but it's not big, maybe 3 or 4 millimeters, 1/4 of an inch, sometimes less. And on the same time as you're doing that, the lips are closed all of the time, and the upper surface of the tongue is on the roof of the mouth, and as much as feels comfortable. And quite often when people are learning, and a bit later, people are used to opening the jaw and the lips open at the same time. So the lips open, or they open the jaw and the tongue comes off the roof of the mouth. But there's an innate ability, probably from suckling, that the lips can stay sealed, not tense, in a relaxed way, that they can stay closed in a relaxed way, and the jaw can move, and the tongue can have a relaxed and soft seal to the roof of the mouth as the jaw moves. I'll just demonstrate so people can see that it really is a very subtle movement of the jaw. So I'll just do just for a few moments. So and very quickly drop into an alternative state, kind of a shamanistic, very relaxed place. So we're going to go through some exercises, but this time with our eyes open. First of all, to get that seal on the lips, notice you can kind of purse your lips. You can, it goes in here, and the lips stay closed. Try that a few times. You drop the jaw and the lips stay closed. And now also put the tongue on the roof of the mouth and pull the jaw down. And notice it's like you get a suction with the tongue as the jaw drops down. So you can make a seal, and that is very similar to what babies do. Their lips seal around the nipple in a relaxed way, and the tongue seals the nipple to the roof of the mouth. So we can make a seal, a natural ability to making seal, but now doing that in a very relaxed way with a much smaller motion of the jaw. So the lips are relaxed with a light seal, the flat of the tongue on the roof of the mouth with a very relaxed seal, and now just in a small way, or however big, opening the jaw. The lips stay sealed, the tongue stays on the roof of the mouth, the jaw closes, the lips stay sealed, the tongue stays on the roof of the mouth. Now make that movement a bit smaller. And now it's a bit like a pump. Notice as you're opening the jaw, it's natural to breathe in through your nose. As your jaw drops down, it's like a little pump. It brings the air in through the nose. Then as the jaw rises, it's like a pump. The breath comes out through the nose. So just being with that, and make the movement smaller. The jaw opens, you breathe in through the nose. The jaw closes, you breathe out through the nose. The tongue stays on the roof of the mouth. The lips stay closed with a very light seal. And now turning that round, so rather than the focus being on the jaw, you change the emphasis. Be aware of the breath coming in through your nose, and as the breath comes in, the jaw gently opens. Then as the breath comes out, the jaw gently closes, and notice how that takes the pressure away from the jaw. It becomes much more relaxed when you have the emphasis on the breath. So as you're breathing in, the jaw gently opening, the lips still have this very natural light seal, the tongue has a very natural light seal. Then as you breathe out, the jaw naturally closes. And notice there's a lot of people already closing their eyes and going into an altered state. Notice you start feeling very relaxed, and it's hard to keep your eyes open. You're drifting into a different state. As you breathe in, the jaw naturally opens with it. As you breathe out, the jaw naturally closes. And smaller, slower motion of the jaw, the lips stay relaxed and closed, the tongue stays on the roof of the mouth. Relax the back of the neck, relax the back of the head. Notice it gets harder and harder to actually do it and keep the eyes open, because you're drifting into a different state of consciousness. And it's good to relax the back of the neck and back of the head, because a lot of the energy is coming through there. Now letting the eyes close, and if you want, let the eyes close, just naturally being with that, As you breathe in, the jaw is gently opening. As you breathe out, the jaw gently closing. Notice how natural that feels. You get these waves of energy, waves of relaxation moving through your body. Very soft, relaxed seal in the lips, very soft, relaxed seal in the tongue. It's the upper surface of the tongue on the roof of the mouth. The tip of the tongue is close to or touching the front teeth. Maybe half an inch or an inch of the tongue on the roof of the mouth. The more you do, the more of the tongue naturally starts covering the roof of the mouth. But to start off with, whatever feels most comfortable. Notice you go into this place that's halfway between being awake and being asleep. It's like the dream state. It's a very shamanistic space. It feels very natural. Relax the throat. As you breathe in, the chest is opening, the jaw is opening. As you breathe out, the chest is closing, the jaw is closing. As you breathe in, the abdomen is opening, the jaw is opening. As you breathe out, the abdomen is closing, the jaw is closing. You may be able to feel it right down into the pelvis. So breathing in, the pelvis is opening, the jaw opening. As you breathe out, the pelvis closing, the jaw closing. But also notice in a very subtle way, the whole face has started to breathe. This gentle motion of the jaw connects through every cell, through every part of us, and it especially connects up through the face, through the brain, through the cranium, through the neck, through the throat, connects it to the rest of the body. And this whole area that wasn't really breathing so much before, in a very subtle way starts to open and close with the breath. And it's not a physical thing you're aiming for, it's very subtle. The more subtle you do it, the stronger, more profound the experience is. And as the jaw closes, it's okay for the teeth to touch, but they just float together. There's no pressure, they're not resting and pressing together. They may just bounce around, gently touching a tiny bit. Or the jaw can just be slightly separate as you breathe out. Breathing in, the jaw gently opens with the breath. Breathing out, the jaw relaxes closed. It relaxes open and it relaxes closed. You drop into a deep, shamanistic, alternative space, channel. But it's your own channel, it's you, your energies, connecting with the earth, connecting with the higher self, which are reflections of you, very resourceful, very nutritious on all levels. Okay, and gently allowing yourself to come back.